Welcome to East Valley Community Health Center. My name is Lelenia Navarro and I'm the Chief Operating Officer here at East Valley. I really wish that I could do this tour in person, but I hope to be able to give you a glimpse into what we do here at our federally qualified health center in partnership with the residency program. And if you select Emanate as your residency program, what you can expect in terms of your time here at the outpatient center. East Valley is accredited as a patient-centered medical home. What that means is that we meet various guidelines in which really put the patient at the center of everything that we do. Right now, we're standing in one of several care team areas. At East Valley, we work in comprehensive care team, knowing that it takes more than just a medical provider to wrap around the holistic care that we provide here at our health centers. On each team, you have your medical providers and your MAs, which is your traditional model, but you also have a registered nurse case manager, licensed vocational nurse to help expedite care and close gaps in care during the patient's medical visit. We have social workers who are able to assess for anxiety, depression, drug and alcohol abuse during the patient's medical visit in order to provide brief interventions as part of the care that you will serve each and every day at our health centers. It's very comprehensive, and like I said, there's some things that do happen inside the exam room, but there's so much more that does happen outside of the exam room, and it takes a full team to really make that happen. One team member who I didn't mention, but who will be your biggest cheerleader, are our nutritionists. They work side by side with our medical providers to really enhance the care provided, especially for our diabetic patients. We have a large number of diabetic patients who really need our help. And so what they do is critical to really being able to partner with the medical provider. So I hope that this helps to define what we do in terms of our care team here at East Valley and what you can expect if you were to practice care here within our health center walls. At the two health centers in which the residents practice, we have been fortunate to renovate and establish care in a care team model, meaning that the physical space matches the model of care. We are able to have multiple stations within our areas, and that is where the support staff really sit, and then the provider sits at hand's reach in a separate office with their other colleagues in order to really enhance and promote effective communication during the course of care. We're fortunate at East Valley to have access to dental care within our health center walls. We have dental not just at our West Covina facility, but also at our La Puente and Pomona facility. We're able to provide full comprehensive dental services in which the medical provider works with the dental provider to take care of the patient holistically. As you can see, we have state-of-the-art operatories, and we really see that this is a much added value services to our community. At East Valley, we work to bring as many services inside of the walls as possible, removing barriers to access to care for our patients. One of which you're seeing here today is our X-ray machine. We are able to provide full X-ray machine imaging for our patients. Weight bearing, this is such a great added feature. A provider can see a patient on the first floor, send them up for X-ray, and then they can actually do a wet read. All of our X-ray images go out to an external radiology group, and then the report will come back for the physician to review and follow up with the patient accordingly. But the really good access point is that the provider here can actually see the read immediately after it has been done, which is a great added feature. If we come right down the hall, we'll kind of keep going in our essence of bringing services inside of the health center. We do contract with Quest Diagnostic to provide in-house laboratory services. Again, the provider downstairs ordering a lab, the patient has the ability to come straight up the stairs and go ahead and get their lab drawn. We know that, me personally, I know if a provider sends me to go get my lab, if there's even a line, I probably will leave and I won't get it done. So what we're really trying to do is remove as many barriers to care so that you can really speak to the patient's health needs and be able to address them with all of the tools that you may need at hand. In this room right here where it says treatment in progress, this is our retinal scan rooms. As I mentioned earlier, we have a large population of diabetic patients where retinal scans becomes increasingly important to make sure their eye health stays well, and we're able to see all of their healthcare needs in addition to their general needs. East Valley partners with PharMedQuest to provide in-house pharmaceutical services at our West Covina, Pomona, and Covina location. This is a critical service for the residency and your learning experience here at the outpatient setting. What this means for you is that you will prescribe a medication and the pharmacist in-house can see what you prescribe, they can see the medical notes, they can understand what you're trying to do. And if there's any issues, they can literally go downstairs and talk to you, and it becomes an enriched learning experience for the residents themselves. I've personally seen the residents really talking about this program as one of the main benefits that they're able to get out of working collaboratively with a pharmacist within the same building in which they're seeing their patients. The residency program has special rotations here at our health center, 2 of which are OB-GYN and HIV services. The residents have the opportunity to rotate with experienced OB-GYN providers, one of our OB-GYN providers in which has been here for over 15 years, and I hear nothing but positive reviews in terms of your rotations together. Our HIV provider similarly has been here for quite some time and has really built out our practice, and you will have an opportunity to rotate with both of them. Our HIV provider also provides hepatitis care, and in the last 3 years in our partnership with the Pharmaceutical program, we're able to start treatment for Hep C and really wrap around care for this group of individuals. What you'll see here in our exam room is our technology that we use in the course of the medical visit. We do have next-gen electronic health records here at East Valley in which you will use to document, but we also have a program called Eye-to-Eye Population Health Management. This program sits on top of the EHR to easily extract information about the patient group in which you will be impaneled to. It can tell you things about how well your patients are doing, how many diabetic patients do you have, what's their average A1C. What it also tells you and provides to you is a daily tool that outlines every patient that is going to come in and see you that day. It clearly and easily shows you gaps in care. Does the patient need an immunization? Does the patient have a recent lab that needs to be either reordered or encourage the patient to go complete their lab? All these tools are critical to helping the provider be the provider in the room and not worry about the administrative pieces outside of the room. So we were fortunate to be able to get 5 counseling offices out of this space that we're standing in right now. These services are critical to really partnering with the medical provider to provide ongoing counseling services, in addition to what we talked about earlier with a social worker being embedded into the team of care that you're providing on the clinical floor. As you see from some of the pictures on our walls that explains East Valley history, you can see the growth within our organization. We are hitting a milestone this year with our 50th anniversary. And what you'll see in a lot of FQHCs or community health centers is that we're all around the same age. But why is that? Really, community health came out of this free clinic idea, this healthcare for all and access, especially to reproductive health. So what you will find, similar to East Valley's experience, is that these clinics formed out of a need to serve women's health and reproductive access to care. We started at that point and then realizing soon after that we needed to serve the babies, then the husbands, and like many practices, become full family medicine at that point. So it's really exciting to be connected to such a rich history that brings us back to what is important in our society and what we all fought for in terms of access to care for all individuals within our community. At all of our health centers, we've been fortunate enough to deploy medication-assisted treatment program. What that means for the medical providers is that there's special training, which East Valley collaborates with Emanate on, to get you certified to be a MAT provider. They work in collaboration with our social workers to help the patient get on and stay on therapy if the team feels like this might be the best choice for this specific person. We do MAT therapy for both opioid and alcohol abuse. So there's a few more services that I want to be able to let you know that we do both inside of our health centers and within the community, which is really important and part of our core mission. We have, to give you an idea of the growth of our health center, we have 8 health centers currently, opening 2 during the pandemic, which I can tell you was a badge of honor. 2 of our health centers are school-based health centers, one in an elementary school and one at a junior high school. At those health centers, 3 of them have dental services. 1 currently has vision services, and we will be adding a second location with vision services in the next few months. We just opened our newest site at Hope for Home Shelter in Pomona. This project has been an ongoing project and that I've been speaking to the residents for many years about, so we're very excited to add this into our suite of clinics. Hope for Home Shelter is a full campus for homeless individuals really looking to move into permanent supportive housing. On that campus, led by the City of Pomona, you have Volunteers of America, East Valley Community Health Center, and Tri-City Mental Health, working in partnership to wrap around services of each individual staying at the shelter. In addition, we serve homeless individuals outside of the shelter itself. We have homeless programming in which we've had for years in order to provide case management services, not just for individuals inside the health centers partnering with the medical providers, but individuals that we connect with in the community. We know that the medical provider has a lot on their plate and that you might not always know the resources for food banks or shelters or how to get someone into housing. However, we know that those social determinants of health do impact a patient's health outcomes. And so with this program, we're able to partner with the team to really advance care for these group of individuals. We also work with previously incarcerated individuals through our whole person care program. Again, a case management program that works with each care team. We have specific case management programs called health homes. And this one's a little bit more general in nature, but really targeting individuals with multiple chronic diseases or individuals who seek frequent care at the emergency rooms. They're patients that might be seeing you, or they're individuals who maybe should be seeing you, but never come into our health center. So we have a group of targeted licensed vocational nurses who really do a good amount of outreach to engage with these individuals and really help them along the course of their care. We do a lot of extra stuff in the community in addition to what I've just explained. We have a garden at our school-based health center at Via Corda, partnering with the kindergarten class and our registered dietitians. So that's a really exciting partnership. We also do HIV testing, in which I started at East Valley on those programs. When I started, we were doing a rapid test. Well, at that time, it would be what we would call rapid. We were getting our results in 2 weeks. Today, we're able to find a patient's results in 1 minute of taking the test and link them directly to care here with our HIV medical provider. We're also recently added PrEP services to our kind of suite of things that we do here. I'm really excited about this program probably because I started in HIV and this was just a thought. We never thought we would be able to get to the ability to prevent HIV using medication, in which we have and are able to actively prescribe here at the health center. We really pride ourselves in the ability to see every patient who walks through our doors, and that is the core of our mission. We obviously as a federal qualified health center, are able to see both insured and uninsured individuals. However, we do our due diligence to help patients qualify for not just county programs, state programs, anything that might be out there to really help them cover the cost of their care, have access to additional programs, and we're able to do that through our enrollment services that we do here at the health center and that we do in the community at large. So I hope what you take away today from this tour, and I wish I could be meeting you in person and shaking your hand, is that we try to be as comprehensive as possible. And in doing so, we really enhance the resident's experience, in my personal opinion, in terms of learning community medicine, serving a complex community, and learning really valuable skills along the course of your residency program. So it was very nice to meet you today, and my hope is that we will be able to meet in person come, I think, August, and based off of the match. So I hope to meet you then. Thank you.